In this video, we will explore the top 25 interview questions commonly asked for NHS Band 2 positions. Each question is designed to assess your skills, experience, and fit for the role within the National Health Service. 1. Tell me about yourself and why you're interested in this NHS Band 2 role. I have a strong background in healthcare support, with experience in patient care and administrative tasks. My passion for helping others drives me to seek a role where I can make a meaningful impact on patients' lives. I am particularly interested in this NHS Band 2 position because it offers the opportunity to work closely with patients, ensuring they receive the care and support they need. I admire the NHS's commitment to high-quality care and its core values, and I believe my skills and dedication align well with this role and its responsibilities. 2. Why do you want to work for the NHS? I am passionate about contributing to the health and well-being of my community, and the NHS represents an incredible opportunity to make a meaningful impact. The NHS is known for its commitment to universal healthcare, which aligns with my values of equality and accessibility. I admire the organization's dedication to patient care and its focus on continuous improvement in healthcare services. Working for the NHS would allow me to develop my skills in a supportive environment while being part of a team that prioritizes compassion and excellence in patient care. 3. What do you know about the responsibilities of this particular Band 2 position? The Band 2 position typically involves supporting healthcare professionals in delivering high-quality patient care. Responsibilities often include assisting with basic patient needs, such as hygiene and mobility, ensuring that patients are comfortable and safe. The role may also involve maintaining cleanliness in the work environment, managing patient records, and following protocols for infection control. Additionally, effective communication with patients and team members is crucial, as well as adhering to the policies and procedures set forth by the NHS to guarantee patient safety and well-being. 4. What qualities do you think are essential for success in this role? Successful candidates in a Band 2 role should possess strong communication skills, as they will frequently interact with patients and colleagues. Empathy is crucial for understanding and addressing patients' needs effectively. Attention to detail ensures that care is delivered accurately and safely. Teamwork is essential, as collaboration with other healthcare professionals enhances patient care. Flexibility and adaptability help in managing the dynamic nature of healthcare environments. Finally, a commitment to continuous learning will support personal growth and improve service delivery. 5. Where do you see yourself in 5 years' time? In 5 years, I envision myself developing my skills and advancing within the NHS. I aim to take on more responsibilities, possibly in a supervisory role, where I can mentor others and contribute to improving patient care. I hope to engage in continuous learning, attending relevant training programs to enhance my expertise. My goal is to become an integral part of a dedicated healthcare team, fostering a supportive environment that prioritizes patient well-being. I believe this will not only benefit my career but also positively impact the patients we serve. 6. What are the 6 core NHS values and why are they important? The 6 core NHS values are: 1. Compassion, providing care with empathy and kindness. 2. Respect and dignity, treating everyone with respect, ensuring their dignity is upheld. 3. Commitment to quality of care, striving for the highest standards in health services. 4. Improving lives, focusing on the well-being of patients and communities. 5. Working together for patients, collaborating effectively across teams and disciplines. 6. Everyone counts, valuing diversity and ensuring equality in service delivery. These values are essential as they guide the behavior and attitudes of NHS staff, ensuring that patients receive compassionate, respectful, and high-quality care. They foster an environment where teamwork thrives and every individual feels valued, contributing to better health outcomes and enhanced patient experience. 7. Can you give an example of how you've demonstrated compassion in a previous role? In my previous role as a care assistant, I encountered a patient who was feeling anxious and isolated due to a recent diagnosis. I took the time to sit with them, actively listening to their concerns and validating their feelings. By providing emotional support and reassurance, I helped them understand their treatment options better. Additionally, I organized small group activities that encouraged social interaction, which significantly improved their mood and comfort level. This experience reinforced the importance of empathy in healthcare and strengthened my commitment to providing compassionate care. 8. What do you understand by the term patient confidentiality? Patient confidentiality refers to the ethical and legal duty to protect a patient's private information from unauthorized disclosure. This includes any details shared during consultations, medical records, and personal identifiers. Respecting patient confidentiality is crucial in building trust between healthcare professionals and patients. It ensures that individuals feel safe to share sensitive information, which is vital for accurate diagnosis and treatment. Breaching confidentiality can harm the patient-provider relationship and may lead to legal consequences for the healthcare provider. 9. How would you ensure you're providing high-quality care to patients? To ensure I'm providing high-quality care to patients, I would prioritize clear communication and active listening. Understanding each patient's unique needs is essential. I would continuously monitor their condition and reassess care plans as necessary. Regularly updating my knowledge through training and staying informed about best practices is vital. Collaborating with my team to share insights and strategies can enhance patient care. Additionally, I would solicit feedback from patients and their families to identify areas for improvement, ensuring that their voices are heard in their care process. 10. What challenges do you think the NHS is currently facing? The NHS is currently facing several significant challenges. One major issue is the increasing demand for healthcare services, partly driven by an aging population and the rise in chronic illnesses. This demand often leads to longer waiting times for patients. Another challenge is staffing shortages, which can impact the quality of care provided. Additionally, budget constraints force the NHS to make difficult decisions about resource allocation. Finally, the integration of technology into healthcare presents both opportunities and challenges, as staff must adapt to new systems while maintaining patient care standards. 11. Describe a time when you worked effectively as part of a team. When I worked as a volunteer in a local community health initiative, our team was responsible for organizing health screening events. Each member had a specific role, from logistics to patient engagement. We held regular meetings to discuss progress and address any concerns. I noticed that one team member was struggling with their task, so I offered assistance and shared some ideas to streamline their work. By collaborating and supporting each other, we successfully held multiple events that attracted a large number of participants, ultimately helping to raise awareness about health issues in our community. 12. Give an example of when you've had to communicate complex information clearly. In my previous role as a healthcare assistant, I often had to explain medical procedures to patients who were anxious and uncertain. One instance involved a patient scheduled for a complex diagnostic test. I broke down the process into simple steps, using clear language and visual aids. I checked in frequently to ensure the patient understood each part and encouraged questions to alleviate their concerns. By doing this, I helped the patient feel more comfortable and informed, which ultimately led to their cooperation during the procedure. This experience reinforced my belief in the importance of clear communication in healthcare. 13. How do you prioritize tasks when working in a fast-paced environment? In a fast-paced environment, I prioritize tasks by assessing urgency and impact. I start by identifying critical tasks that directly affect patient care and safety. I utilize a to-do list to keep track of priorities, adjusting as new tasks arise. Communication is key. I regularly check in with my team to ensure alignment. I also break larger tasks into manageable steps, which allows for flexibility. By remaining organized and focused, I can effectively manage my time and ensure that essential duties are completed promptly without compromising quality. 14. Tell me about a time you dealt with a difficult or upset patient, customer. In a previous role as a healthcare assistant, I encountered a patient who was frustrated due to a long wait time for their appointment. I approached the situation calmly, acknowledging their feelings and apologizing for the delay. I listened actively to their concerns and provided updates on the situation. After reassuring them that their care was a priority, I offered them a cup of tea while they waited. By maintaining open communication and showing empathy, I was able to ease their frustration and ensure they felt valued throughout their experience. 15. What experience do you have with record keeping or data entry? I have hands-on experience with record keeping and data entry from my previous roles, where I managed patient information in electronic health record systems. I ensured that all data entries were accurate and up-to-date, which involved regular audits and cross-referencing with physical files. Additionally, I have been responsible for maintaining confidentiality and security of sensitive information, following protocols to protect patient privacy. My attention to detail and organizational skills allow me to effectively handle large volumes of data while minimizing errors, ensuring that records are reliable and accessible when needed. 16. If you witnessed a colleague behaving inappropriately towards a patient, what would you do? If I witnessed a colleague behaving inappropriately towards a patient, I would first ensure the patient's immediate safety and well-being. I would then document the incident as accurately as possible, noting the time, location, and nature of the behavior. Next, I would report the behavior to a supervisor or manager promptly, following the NHS's policies on safeguarding and whistleblowing. It is essential to address such issues to maintain a safe and compassionate environment for patients and uphold the integrity of the healthcare profession. Taking action helps protect patients and reinforces a culture of accountability. 17. How would you handle a situation where a patient refuses care or treatment? In such a situation, I would first ensure the patient feels heard and understood. I would calmly ask them about their concerns and reasons for refusing treatment, providing a safe space for open dialogue. It's crucial to educate the patient about the implications of their decision, ensuring they have all the necessary information to make an informed choice. If appropriate, I would explore alternative options that may align better with their preferences. Throughout the process, I would remain respectful and empathetic, prioritizing the patient's autonomy while ensuring their safety and well-being. Maintaining clear communication with the healthcare team is essential for follow-up actions. 18. Describe how you would respond if you made a mistake while caring for a patient. If I made a mistake while caring for a patient, my first step would be to assess the situation and ensure the patient's safety. I would then promptly inform my supervisor and the healthcare team about the error, providing all relevant details. Open communication is essential in healthcare, and I believe that addressing mistakes quickly helps prevent further issues and promotes trust. Afterward, I would reflect on the incident to understand what went wrong and how it occurred, ensuring that I learn from the experience and implement measures to prevent similar mistakes in the future. 19. What would you do if you noticed a potential safety hazard in your work area? If I noticed a potential safety hazard in my work area, my first step would be to assess the situation to determine the level of risk involved. If it's safe to do so, I would take immediate action to mitigate the hazard, like alerting others or removing any dangerous items. Next, I would report the hazard to my supervisor or the appropriate department to ensure it is addressed properly. Additionally, I would document the incident to help prevent similar issues in the future and participate in any safety training or discussions to enhance awareness among colleagues. 20. How would you deal with conflicting instructions from two different supervisors? When faced with conflicting instructions from two different supervisors, I would first seek to clarify each instruction to fully understand their expectations. I would then approach both supervisors, respectfully highlighting the conflicting guidance and expressing my desire to ensure that I meet their needs. By facilitating a discussion between them, I could help reach a consensus on the best course of action. It's important to remain professional and open-minded, focusing on collaboration to resolve the issue while ensuring that I continue to fulfill my responsibilities effectively. 21. How do you handle stress and pressure in the workplace? Handling stress and pressure in the workplace requires a combination of strategies. Firstly, I prioritize my tasks by identifying what needs immediate attention and what can wait. I practice deep breathing techniques to maintain focus and calmness during hectic moments. Additionally, I find that staying organized, whether through lists or digital tools, helps me manage my workload effectively. Regular breaks are essential for me to recharge. I also communicate openly with my team, seeking support when necessary, which fosters a collaborative environment and helps reduce stress. 22. Describe a time when you had to adapt quickly to a change in your work environment. In my previous role at a busy healthcare facility, we underwent a sudden change in our scheduling system due to a software upgrade. This transition required us to adapt to new procedures and workflows immediately. I quickly organized a team meeting to address concerns and clarify the new processes. By maintaining open communication and offering support to my colleagues, we were able to navigate the transition smoothly. I also took the initiative to create a quick reference guide for the team, which helped everyone adjust faster and maintain our service quality during the change. 23. What do you consider to be your greatest strength that you'll bring to this role? My greatest strength is my ability to empathize and connect with patients. This skill allows me to provide compassionate care, ensuring that patients feel understood and valued during their healthcare journey. I have a strong commitment to listening attentively to their needs and concerns, which helps build trust and enhances their experience. Additionally, my adaptability enables me to thrive in dynamic environments, ensuring that I can respond effectively to the changing demands of healthcare. I believe these qualities will greatly contribute to the positive atmosphere of the NHS. 24. How do you ensure you maintain a high level of accuracy in your work? To maintain a high level of accuracy in my work, I establish a systematic approach that includes attention to detail and regular self-checks. I prioritize understanding the tasks fully before beginning, which helps minimize errors. Utilizing checklists allows me to track progress and confirm that each step is completed correctly. I also take the time to review my work before submission, ensuring that all information is accurate and complete. Seeking feedback from colleagues can provide additional insights and catch any mistakes I might have overlooked, promoting a culture of accuracy and accountability. 25. Do you have any questions for us about the role or working for the NHS? I appreciate the opportunity to ask questions. Could you elaborate on the training and development opportunities available for this Band 2 role? I'm eager to enhance my skills and provide the best patient care possible. Additionally, I would like to know more about how the team collaborates to ensure high-quality service delivery. Understanding your approach to teamwork and communication can help me align with your values and contribute effectively. Lastly, what does success look like in this position within the first 6 months? Remember, practice makes perfect, so take the time to rehearse your responses. We hope you found this information valuable and feel more prepared for your upcoming interview. If you enjoyed the content, please like the video and subscribe for more helpful tips and resources. Good luck with your interview journey.